everyone. This is Myth. It's Tuesday, August 5th, the first day after my surgery, and just wanted to check in with you to let you know what's happened. And I'm feeling great. I know it may look a little great. This, of course, is my neck brace, and there's the incision in there. They've taken really good care of me. I don't really have any neck pain or any pain at all. So I'm sticking to the pain medication on schedule. They weaned me off of the pump, and now I'm just taking the pill so that when I go home, uh, I'll be tolerant to the pain at home. And I'm going to make sure and stick to the schedule, at least at first, that they give me, because I don't want to wake up with excruciating pain. So I'm doing really well. About 9 or 10 o'clock last night after the surgery, I got up and I walked around with the walker, but tonight I walked without the walker around the hospital, and I walked also with physical therapy, so that went really well. This is my IS machine that I use to blow into keep my suck wind out, I guess, to keep my lungs clear, and it goes like this. And I've got to get up to the yellow line to make sure everything is well. I'll also be able to take that home and continue to use it just to make sure that my lungs are open. My doctor is Dr. Nimish Patel, and his assistant came by today to show me the bone stimulator that I'll be using on my neck every day for a while. And it's a pretty simple little machine that just goes on the back of your neck to make sure that the bones are fusing properly. So that's going to be lots of fun, but it's not going to be painful. I haven't really had any bad symptoms. They brought food for me today, and surprisingly enough, I thought that I would have to be on a liquid diet, but this morning I had oatmeal and some very soft eggs. And for dinner, I had tuna fish and some pasta and drinking lots of tea and lots of water, plus getting a little fluid here in my IV to make sure that my kidneys are flushing out well. That has worked very well because I have been to the bathroom quite a few times today. Some assisted by the nurse, but mostly going on my own. So I'm pretty much getting stabilized. I think I'll be going home tomorrow, barring no further complications, which I don't seem to have. I have a little drainage bag that comes down out of my neck, and they've been emptying that. At first it was quite a bit of fluid there, but now there's no fluid there. So that's one of the reasons why the doctor may keep you if they want to make sure all the fluid drains out in the bag, in the pouch. So that seems to be going really well. Other than that, as you can tell, my voice is a little raspy because, of course, as they go in and cut, they move the trachea over, they move the vocal cords over to get to the spot where your vertebrae is and the disc are. So some things in my neck have been moved around. And my doctor explained to me yesterday that I should feel the most pain in my throat on the second day after surgery, which will be tomorrow, because whatever swelling that was setting in, I'll be able to see that or feel that by the second day. But as of right now, the only thing that you can see really is the raspiness of my voice, the neck brace. I don't have to wear all the time. but he wants me to at least be in it for a couple of weeks, or at least until I see him, because they don't want you to do any like knee-jerk reactions and moving your neck. So I'm going to be very compliant and do what they say. It's not uncomfortable. However, I have been sitting up in the bed mostly because it's kind of hard when you lay flat to try to raise your neck. So I have kind of been sleeping upright. Today, I kind of slept off and on, off and on. They gave me different medications today. Vancomycin, of course, is one, and my mom and my aunt have both had those, and they will kill just about every germ in your body. So I guess I was glad to be able to get a dose of that. Other than that, I kind of slept off and on most of the day, which I needed because, I was pretty restless last night. Two of my beasties came. One came about 9, and the other one popped in about 2 a.m. So I talked with her, so that may be some reason why I was sleepy. But all in all my family's been here, and I've been really loved. And so I'll be going home tomorrow, and we'll start down the trek of me not wanting to lose my independence because, now I know I can walk to the bathroom, and I realize that I can walk to the kitchen, and all that broth I bought for this, I'm probably not going to want since I can eat soft food, but I've got a bunch of different soups and broths and all that. So I was hoping it would be worth losing a few pounds. I'm still hoping that. So other than that, the surgery was successful. As you can see, it's a little painful to swallow, but that's to be expected. In the anterior cervical discectomy with fusion therapy, what they do is they cut a small incision in my neck right here in the front, and they clamp it back, and they go all the way down through, I think, some muscle to get to the vertebrae, which is the bone that's leading to your spine. And they take out all of the spongy discs that are in there that have been bulging or have collapsed. Most of the time due to aging, but I've always been that home improvement kind of girl, living in and out of Home Depot, picking up heavy building materials. So I think over the course of time, I thought I was stronger than I probably am. So now I'm not going to be picking up much of anything heavy anymore. Um, the surgery was on my C3 through C6, which are 4 discs that I had replaced. And the doctor put one long metal plate in with 4 screws. So watch out, airport detectors, I'm coming. But you can still do everything to your neck that you normally did in within the course of a year. That whole bone, the whole vertebrae fuses together, and the neat thing that I thought was so great about my neurosurgeon, Dr. Nimish Patel, was he put a small needle into my hip and drew out some stem cells and injected it into the cadaver bones that he put into my vertebrae, which aids with healing. And I'm just so impressed by the cutting edge technology that doctors are using. Dr. Patel is a very young doctor that's really at the top of his game. So I was very impressed with all that he did and that he did to aid in the healing. And now I'm at the point where I've got to go home and do what my mother told me to do long time ago, and that is to be careful and to heal. I won't be able to drive for 2 or 3 weeks or until the doctor says that I can drive. However, I may be able to ride in a car, and when I go out, I'll have to wear the neck brace. And I'm sure I'll wear the neck brace when I'm sleeping. I haven't really taken it off yet. The physical therapy people took it off just to show me how to put it back on or how to operate it. I'll also be getting a plastic neck brace to use in the shower. Um, I brought out my mom's old shower chair that she used as she was aging and put it right in the middle of my tub. So I'm going to sit in that so I won't have to stand in the shower. So it's going to be all good. I'm ready. And I'm not ready to lose my independence. So I'm going to do as much as I can possibly do to take care of myself. Um, if I don't, I've got lots of pillows in my bed already to sleep propped up, but I also have a recliner that I'm planning to stay in most of the time so that I won't have to push my neck off to try to stand up. So if I'm in the recliner, I'll just let it up and stand up that way. So I've already got that set up as well. And I think that's all today that I can tell you. I don't have any soreness in my hip at all where he took the stem cells out, and I see different places where they've gone in and stuck me in different areas that I was unaware of other than when they were putting in the IV. Of course, I have no recollection of the trach going down my neck other than the raspiness. But I'm doing well, and I just want you all to know, everyone who is considering having ACDF surgery, to watch my YouTube videos and post any questions that you might have. I think I'm doing exceptionally well after day one. I'm at the Methodist Hospital for Surgery in Addison, Texas, and all they do is orthopedic surgery here. So my doctor, again, is Dr. Nimish Patel with the Moody Brain and Spine Institute. If you have any questions, feel free to pose them about anything that went on. I described in the video yesterday about all the pain that I'm in, and still got some stiffness across my neck, and they're giving me something to ease that up. And with time, it's all going to go away, and I'm so looking forward to being pain-free and getting on with my life. So that's what's going on with me today. I'll keep you posted when I get home to see if there's going to be any difference or any other symptoms or problems that I may have. I'll be quick to call the doctor and call on Jesus because he alone has helped me through this process so far. So I wanted you to be encouraged because I know that a lot of people are very reluctant in having surgery on their neck because it's a little disconcerting when you start talking about having your neck cut. But from all the research that I've done and all the people, all the doctors, all the professionals that I've talked to, the neck fuses very well. Fuses a lot better than the back because it's just, you don't bend and tug it as much as you do the back. So the neck fuses very well. I've talked with people who are 10 years on the other side of this surgery, and everyone I've talked to has said, I would do it again in a heartbeat to be pain-free. Now, that's not to say that I'm not going to have any problems with my neck because this is no longer the neck the Lord gave me, but it's one that will be pain-free and the one that I will be able to manage. Dr. Patel told me once he's fixed it, I can go on down for another 40 years, barring keeping my weight down, keeping my blood sugars under control. So we're working on that next. And again, I'm here, day one, optimistic, not having any of the things that I thought I would have. And now I'm going into the journey of healing, and I'm going to take real good care of myself so that when I get back to work that I'll be A-OK and tip-top shape. So thanks again for tuning in. I'll probably be back with you tomorrow with another update. And be encouraged, because I think this will be, I think that over the course of the year, I'm not going to post every day forever, but between now and the next year, to let you see how I've progressed with my neck surgery. And thank you for tuning in. Post your questions. I'll be more than happy to answer them. Thanks. Bye.